Hello. I wanted to be able to do a video for you on the benefits of two particular types of breathing. So this video is going to focus on what I describe as chilled out breathing. It has many names and you'll probably recognize some of them as we go through the video. The reason breathing is important, and the amount of times I hear that a hypnobirthing course is all about breathing, it isn't. But the reason we have to breathe in a particular way when we are in labor or when we are giving birth is twofold. So the first, we want to get lots of lovely oxygen into our bodies. So all of the breathing, when I ask you to take a deep inward breath, it needs to be a proper abdominal breath. So I tend to get quite bunged up when I'm pregnant. I'm a bit bunged up now, as you can hear. So I don't know if that's the case for you. So if you are unable to take a big breath in through your nose, don't panic, just take it in through your mouth. If you're a mouth breather, or that's where you feel more comfortable. But I want you to take a really big, deep inhalation of breath and really feel your tummy, your abdomen expand. You can help to do this by lacing your fingers and placing them on your abdomen. And as you take a big breath in, feel your fingers start to separate as your abdomen expands. So a bit like this. Okay, so although my chest rose with the breath, my abdomen also expanded. So that's what I want you to think of when I ask you to take a deep inward breath, an inhalation. If you can't do it through your nose, through your mouth is absolutely fine. So it's important to get lots of oxygen in, and a bit like when we are training for endurance, events, running, you have to breathe in a particular way, because also it creates, the second reason breathing is important, a wonderful distraction. So our brain is very, very clever, but we can trick it and distract it from other things that are going on around us. Now, the distraction element of breathing is often considered counting or visualization. So if you're going to do a count, what I want you to imagine is you breathe in, big, large abdominal breath, big inhalation for the count of 4. And then on your exhalation, I want you to extend that breath as much as you can. Now, the best way to extend an outward breath is to imagine you have a candle placed in front of you and you are trying to flicker the flame, but not blow it out, which means you really need to purse your lips in order to do so. Okay, so you're going to take your big abdominal breath in and then a very slow breath out. Now, if you're counting and you've taken a big breath in for 4, the goal would be to at least double it. But what I'm going to say is in for 4, out for more. And you've got to work with your body on this. Sometimes baby might be right up high under your diaphragm and squeezing you a little bit. So you might find it more difficult to get those really long breaths. Don't force yourself to get to a number. Panic and then suck a breath in, because what we're actually doing is a really good reason to do this type of breathing is when we are able to maintain this type of breathing for 3 minutes or more, we actually stimulate our parasympathetic nervous response. Now, our parasympathetic nervous response combats our fight or flight response, okay, which is our sympathetic nervous response. Now, our sympathetic nervous response sends out our stress hormone cortisol, and also our fight or flight hormone, which is adrenaline. Now, if you've done my course, then you'll understand that adrenaline is pretty much the enemy of birth at most stages, because where adrenaline is present, oxytocin won't be, and oxytocin is one of our main laboring hormones and birthing hormones. So by taking these long extended breaths out and then our lovely large inhalations in, if we continue to do that for 3 minutes or more, it switches that little bit in our brain held in our limbic system that's responsible for our hormones. It switches it over to start suppressing adrenaline. And as soon as adrenaline is suppressed, our oxytocin can rise. Okay, so that's the sciencey bit behind breathing, which is why breathing is really important. And when you understand the science behind it, you can get on board a little bit more. Okay, so we're going to practice our chilled out breathing. Some people call it the golden thread breathing, where you imagine a golden thread and then you're pulling it out of your mouth slowly. Really, you're just trying to purse your lips on this one. So I'm going to get my little ball, my little breathing ball here. Okay, so I'm going to take some nice big breaths in, really expand my abdomen and feel all that air go down. Imagine I'm breathing in air to my baby. And then I'm going to be blowing out, okay? I like to use a count. If you find counting a challenge, You could breathe in a feeling of positive and calm and breathe out negative tension energy. You could breathe in a nice calming colour. What colour do you find really calming and really lovely? Maybe a nice gold or a nice green, or a nice warm colour. What colour do you find that you don't associate with calm? Grey, maybe black, okay? A tension colour. If the counting doesn't work, try breathing in a positive affirmation and breathing out tension, or try the colours, okay? Counting works for me, so I'm going to do it. So I'm going to breathe in for 4 and just out as long as I can for a few minutes. So if you want to join along, do, but be guided by your own body. Okay, here we go. Now, it's really important to probably set a timer, because in order for this to work and to be of benefit and to help us turn that switch off and switch us to our parasympathetic nervous response, you have to do it for 3 minutes or more. And trust me, when your children are old enough to brush their teeth, if you haven't got children yet, 2 minutes is a lifetime. So 3 minutes is even longer. So what you might like to do is, perhaps when you're practicing this breathing, and we do need to practice all of the techniques and tools you are given on my course, you have to practice them, because you are training and working with your natural responses to maximize them to benefit you during labor and birth. Okay, so we don't train if we train for marathons all the time, but when we are preparing, we step up our training, and this is what you need to do in these weeks and months leading up to the big event. Okay, so set a timer. If you are going to do this breathing, maybe do it before you go to sleep. You will have a better night's sleep for it. So perhaps set a timer on your Alexa, or play a song, which is normally sort of 3.5 minutes is average for a song. Put a lovely relaxing song on and just breathe in this very deliberate way for the duration of the song. Okay, you need to be able to switch to this breathing when you need to calm down. You can practice it when you're waiting for appointments. You can practice it when you're sitting on the bus, when you're driving. Like me, if you have children who go a bit feral, you might need a few minutes. Go in the kitchen, practice this breathing, okay? It is something that you need to practice in order that your birth partner can remind you in those down moments when you're not having surges or contractions, and you need to remain calm to keep that oxytocin flowing, and more importantly, that adrenaline suppressed. You can do this breathing. And trust me, when you are breathing in this very deliberate way, if you are being observed by healthcare professionals, a midwife or someone, if you're in hospital or if you're at home, and you are breathing in this deliberate way, they are less likely to interrupt you and talk to you. So actually, it's a great tool for keeping people at a distance as well. And we go through a few more of those little handy techniques you can do just to keep people away from you, to allow you this space to really maximize on the hormones that you were trying to produce to help your labor and your birth progress and go well. So give that breathing a try. If you want to breathe in an affirmation, maybe think of yourself, you're breathing in positivity, and maybe you're breathing out bullshit. You're breathing out those negative comments. Okay. If I was going to pick colours, I'd breathe in a lovely leafy green and I would blow out grey. Whatever works for you. Okay. No one technique is going to work for everyone exactly the same. So find what you connect with the best. Okay. Practice that breathing. And in my other video, we will go through the surge or contraction breathing. Okay. So enjoy.